Yes, hello guys, good day everybody, and welcome to my YouTube channel, The Creative Nurse RN. For more information and updates regarding our kumikitang kabuhayan or small business ideas, we have also organic healthy tips and beauty tips, and we have the everyday life happenings. So ngayong araw, today, we are going to have our topic which is very important for us, and that topic is the facts about the COVID-19 vaccine. Ano yung mga dapat nating importanteng malalaman about COVID-19 vaccine? So, handa na ba kayo sa mga ganong topic? Kasi we are always asking ourselves kung magpapa-immunize ba tayo, magpapa-vaccine ba tayo, mayroong mga side effects, magkaroon ba ako ng pag nag-vaccine ba ako, mas lalo ako magkaroon ng mga ng virus ng COVID-19. So, yan mga pag-usapan natin. But before anything else, please subscribe to my channel, like and share, comments, and also hit the bell button. So, thank you guys, and have a nice day! So guys, balik tayo sa ating topic for today, which is the facts about vaccination. Facts about vaccination of COVID-19. So, ang mostly ma-question ng mga tao ngayon is, pag magpapabaksin ba is there is side effect, or there is magkakaroon ba, mas lalo ba ako magkakaroon ng COVID-19, kasi yun yung mga nababalita, yun ang mga nasasabi, mga false news, fake news, mga ganong mga maririnig natin sa mga palibot, sa mga environment natin. So, dapat nating pag-usapan ngayon is kung magpapa-inject ba ng vaccine, hindi na ba ako magkakaroon ng COVID-19 forever, or ano ba yung side effect, or yung kung may sakit ako or buntis ako, pwede bang magpapa-vaccine ako ng COVID-19 vaccine? So, yan yung mga facts o yung mga questions na dapat nating malaman kung pwede nga ba or hindi, or totoo nga ba or hindi. So, facts about vaccination. So, now there are authorized and recommended COVID-19 vaccines in the United States. Accurate vaccine information is actually critical. So, itong mga usapin na to is not that ordinary. So, we have to consult the authorized person or authorized government agency regarding this matter, like the Ministry of Health kung sa Philippines, the FDA or the Food and Drug Administration, and we have to read also regarding the vaccination or the COVID-19 vaccination. We have so many facts, and we have some important news or some important information in the CDC or the Central Disease Control of the Disease Center. Balik-baligtan na naman. Basta ganon. Okay. So, this one was released by the CDC, the Center for Disease Control and Prevention pala. Okay, so Fact number 1. COVID-19 vaccines will not give you COVID-19. So, yung COVID-19 vaccines will not give you COVID-19. Yung virus ba, pag nagpa-inject ka ba ng COVID-19 vaccine, it will not give you COVID-19. So, none of the COVID-19 vaccines currently in development or in use in the United States contain the live virus that causes COVID-19. So, hindi siya live virus. So, ibig sabihin, hindi siya buhay, hindi siya live na virus na vaccine na pagka na-inject ka, magkakaroon ka ng virus. Just like the other news that they said, I just heard from I just heard from my I just heard from my one of my companion na sa ano daw sa India, yung prime minister nila binigyan daw ng vaccine, tapos instead na magkaroon siya ng immunization, nagkaroon pa daw siya ng ng virus, COVID-19 virus. Maybe because before na nabigyan siya ng injection, na meron na siya talagang COVID-19, baka hindi siya nagpa-check or something, mga ganun na eksena. Kasi hindi naman natin yun talaga malalaman kung tama or hindi. Kasi yung mga chismis-chismis lang, chika-chika lang yung mga ganun. So, that's the number one fact. So, we have also here, however, the goal of each of them is to teach our immune system how to recognize and fight the virus that causes COVID-19. So, sometimes this process can cause symptoms such as fever. These symptoms are normal and at a sign that the body is building immunity. So that is the common only. Even whatever vaccine na mabigay sa atin, like any kind sa mga babies also na mag-receive ng vaccine, meron talaga yan na symptoms na magkaka-fever, maglalagnat, minsan ubo, minsan yung may mga, basta most common is the lagnat or fever. So it means like the only na nagfa-fight or nagkakaroon lang ng interactions yung ating katawan sa vaccine. It means na these symptoms are normal and are sign that the body is building immunity. Yun ang ibig sabihin lang nun. So, number 2 fact. COVID-19 vaccines will not cause you to test positive on COVID-19 by viral tests. So, yun ang number 2. So, neither the recently authorized and recommended vaccines nor the other COVID-19 vaccines currently in clinical trials in the United States cause you to test positive on viral tests. So, neither it will become a positive test in viral test. So, it means hindi siya magpapositive, which are used to see if you have a current infection. So, if your body develops an immune response, which is the goal of the vaccination, there is a possibility you may test positive on some antibody tests. So, in some other ways, nahulog, sorry. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. Pwede pa bang injectionan yung mga taong mayroong COVID-19 na nagkasakit ng COVID-19 to be vaccinated? So, due to the several health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible, people may be advised to get a COVID-19 vaccine even if they have been sick with COVID-19 before. So, kahit na yung tao na yon na nagkasakit na ng COVID-19 tapos naka-recover na, kailangan mabigyan pa rin siya ng COVID-19 vaccine. Because at this time, experts do not know how long someone is protected from getting sick again after recovering from COVID-19. So, wala pang nakakaalam kung talagang hanggang kailan yung immunity ng isang tao or makarecover, hanggang kailan makarecover ang isang tao sa COVID-19 na previously na meron na siya. So, fact number 4, getting vaccinated can help prevent getting sick with COVID-19. So, getting vaccinated, kung ma-injectionan ka na ba, magkaroon ka pa, magka-prevent ba, ma-prevent niya ba ang magkakaroon ng COVID-19 na sakit or hindi? Yung ganon. Getting vaccinated can help prevent getting sick with COVID-19. Anong sagot? So, while many people with COVID-19 have only a mild illness, others may get a severe illness or they may be even die. So, there is no way to know how COVID-19 will affect you, even if you are not at increased risk of severe complications. If you get sick, you also may spread the disease to your friends, family, and other around you while you are sick with COVID-19. So vaccination can help protect you by creating an antibody response without having to experience sickness. Yun siya. So, makaka-help siya na mag-protect sa'yo sa pag-spread ng infection sa ibang tao din. So, for example, simba ko lang, ako may COVID-19, tapos siya wala, tapos ako may vaccine na. Pero hindi pa rin yun, hindi ko siya ma-spreadan ng COVID-19 virus kasi wala siyang vaccination. So, yun siya. Fact number 5. Receiving an mRNA vaccine will not alter your DNA. So, kung baga yung DNA natin, yan yung ating genetics, our genes. So, hindi ba siya magkaroon ng alterations or ng side effect or complications ba sa ating DNA? Yung vaccine, hindi ba siya maka-alter, hindi ba siya yung maging maiba or ma-affect sa ating DNA, sa ating genes? So, mRNA meaning stands for a messenger ribonucleic acid and can most easily be described as instructions for how to make a protein or even just a piece of a protein. So, kasi yung mRNA is only a protein. Ribonucleic acid is a kind of a protein. So, it's just a way. It is the one who described as instructions for how to make a protein or even just a piece of a protein. So, mRNA is not able to alter or modify a person's genetic makeup. So, hindi siya maka-modify, hindi siya maka-alter sa ating genetic makeup or sa ating genes or sa ating heredity, sa ating hereditary, sa lahat mga ganon, sa ating genetics, sa ating DNA. Next is, so what are some of the common questions naman na maririnig natin regarding sa COVID-19? What are the common questions? So, one common question is, how do I know which sources of COVID-19 vaccine information are accurate? So, paano niya daw malaman kung ang source of COVID-19 vaccine information are accurate? Paano? It can be difficult to know which sources of information you can trust. So, at this time kasi marami nang nagbablog or marami nang nagbibigay ng information sa YT regarding sa mga vaccines, sa mga COVID-19 vaccines. But this information I'm reading to you is from the CDC. This one you can find it in the Googles. I'm just sharing to you because maybe you cannot read this one also, no? So, because sometimes we are so much busy. So, I just share this one, but my reference is from the CDC. And this one from the Googles, okay? So, learn more about finding credible vaccine information. So, I recommend you in the health section of the Google, there is information there about in the WHO or the World Health Organizations. They have also some other informations regarding vaccination of COVID-19 in the CDC and so many others, and the Ministry of Health or something like that, or yung mga health agency ng ating gobyerno or ng ating government. Okay? So, what else? What are the symptoms? Mga symptoms ng coronavirus. I already told you about the symptoms of this coronavirus la. So I will not repeat it. What else? And who gets vaccinated first? I also this one talk about before. The one who will be vaccinated first is the frontliners, government officials, the one who is in the health facility, the police, the one in the liners, like in the store, in the public transit, or in the government officials, the doctors, nurses, yung mga nakakausap at palaging nakakasalamuhan ng mga publiko, ng mga tao, at saka sa mga health practitioners din, or saka sa doctors, nurses, because they are dealing with the sick people like the COVID-19 patients like that. Nurses, because they are dealing with the sick people like the COVID-19 patients like that. So most probably there is tendency that you will be affected because you are always in front of this patient who has having coronavirus. So instead that they will not spread also it to their families, to the other people, to the community, so they will be vaccinated first. So what else? We will see here. We have so much question here. So when will a COVID-19 vaccine be available in the United States? So the goal for Operation Warp Speed is to deliver safe vaccines that work, with the first supply becoming available before the end of 2020. So before the end of 2020, now so 2021 they are starting. Here also in our, as I heard, here in our hospital, we according to the infection control, they will give 200 vaccines for those people who are more prone to the infection, or prone to the virus infection. So they will do first to those who are sick, who are having comorbidities, yung mga ganun muna siguro. Kasi yung ano yata is 200 pieces lang na vaccine muna dito sa aming hospital. Then what else? So does CDC have a national campaign to address any concerns people may have about getting a vaccine, a COVID-19 vaccine? Yung CDC, yung sabi ko, Center for Disease Control Prevention. Meron ba silang national campaign? But the answer is no. CDC is not leading a national campaign on COVID-19 vaccination. CDC's vaccination activities fit within and are guided by a vaccinate with confidence strategic framework. So yan, hindi sila hindi sila hindi sila nag-work to plan for the distribution of COVID-19 vaccines. What else? What will there be enough vaccine for everyone? So there is enough vaccine ba sa everyone? Currently, 2 vaccines are authorized and recommended to prevent COVID-19 in the United States. So to help guide decisions about how to distribute limited initial supplies of COVID-19 vaccines, CDC and the Advisory Committee on Immunization Practice have published recommendations for which group should be vaccinated first. Yun yung sinasabi ko na they will choose who will be vaccinated first. So next, sana nakakatulong sa atin itong aking vlog, itong aking mga facts about the COVID-19 vaccines. So what can I do now to help protect myself from getting COVID-19 since a vaccine is not yet available? So anong gagawin nyo? You have to take care of yourself. Like you have to wear face mask, you have to wear the face shield, and having social distancing. And if you are sick, you have to isolate yourself. If you are sick also, you have to do the test, and you have to know the information about the signs and symptoms of COVID-19 virus. Yun lang. So what else? We are getting vaccinated. How many shots? So how many shots of COVID-19 vaccine will be needed? I already discussed it before, and it must be 2 shots. Okay? So do I need to wear a mask when I receive a COVID-19 vaccine? Of course, you have to wear a mask and a face shield. Di naman pwedeng hindi na, di ba? Yun lang. Yun yung mga common na mga questions. So if you are sick, you can still acquire the vaccine. Yes, of course, you can still acquire the vaccine. Okay? After you have been healed or something like that. Because if you are sick, what do I do if you are sick? Isolate if you are sick. When to quarantine, you have to quarantine to yourself from your family, from your friends, like that. But if you, they are still entitled to have the vaccination after, even though they are sick also. Because there is tendency again that they will be having they will have acquired again another COVID-19 virus. Yung ganon. So, what else we're going to talk about? That is some facts about the COVID-19. So I hope that it learns a lot for us, and don't be don't be ignorance of the COVID-19 vaccine. Just read and have knowledge and information about the COVID-19 vaccine before you are going to get the vaccination. It's better to have small, at least a knowledge on what you are going to do after the vaccination. So thank you very much, guys, and I hope that you will you learn something on my discussions in today's video. So thank you very much, and be safe always, and don't forget that it's better to be healthy, to be beauty, and be wealthy. Thank you very much, and have a nice day. Bye bye.